With Washington headed for the sequester, the nation's governors are in town, and they're warning those federal spending cuts may drive their states back into recession. Here to talk about it, Republican Governor Scott Walker of Wisconsin and Democratic Governor Jack Markell of Delaware, head of the National Governors Association. And gentlemen, welcome.
Thank you. Good to be.
Let's start with the sequester and what it will mean to your two states. Governor Walker, according to a study, it will cost Wisconsin $1.8 billion and 36,000 jobs and mean big cuts in health services for mothers and children and special education funding. How worried are you about the sequester in terms of Wisconsin, and do you support congressional Republicans' willingness to let the cuts kick in if the alternative is to raise taxes, the Obama idea?
Well, I think all of us as governors have a real concern about what the impact is going to be on our respective states, both in terms of the potential of the cuts if they do nothing, but also in terms of what some of the alternatives might be. I mean, we already had the first wave of impact of tax increases from the last budget deal just a little bit over a month ago. We're seeing the impact. I mean, a typical family making $50,000 now is paying $1,000 more a year in terms of taxes. That's money out of the economy as well. And so if we're not careful, a tax increase on one end could be a problem. Severe cuts on the other end could be a problem. One of the biggest problems we have here in this city is too many times they kick the can, doesn't matter which party, down the block, if you will, and don't really solve the problem. So our hope is between now and March 1st to find a way to provide some better alternatives to the cuts in the sequester.
But you wouldn't support the Obama deal of a mix of tax hikes and spending cuts.
Well, I'm a little confused because when the president proposed the sequester back in 2011, he said the cuts are so bad in this that the Congress and the administration will come back and provide a better alternative of cuts. Not new taxes. They already had the tax increases. That came at the end of this last year when we avoided, or at least temporarily avoided, the fiscal cliff. The challenge now is to find better long-term ways to solve the fiscal problems facing this country right here in Washington.
Governor Markell, you have a much smaller impact of the sequester in Delaware. How worried are you about it?
Well, we're very concerned, particularly the effect on the economy. You know, I think a lot of us feel like after some very difficult years, we're starting to come out of it. Things are getting a little bit better. And unfortunately, the sequester could put us right back where we were. You know, we spend so much time as governors trying to put people back to work. And so one of the most frustrating conversations any governor can have is with an employer who says, I've got vacancies, but let's say I can't find people with the right skills. Well, one of the effects of the sequester could be, for example, to hit workforce development training funds. That's crazy. And one of the things that we've got to do is we've got to figure out a way to putting people back to work as opposed to seeing cuts like that.
Are you literally saying that the sequester could push your state, other states, back into recession?
I don't think there's any doubt about it. I mean, I think the Congressional Budget Office estimates there could be 750,000 fewer jobs. You know, people talk, what's the effect on states of the sequester? The real question is, what is the impact on the people that we serve? States are only a vehicle for service. And so whether it's the fact that things like Head Start, special ed, substance abuse training, low-income energy assistance, or workforce development funds, that all hits us. It hits our budget. The real big impact, though, could be on the economy and jobs.
Governor Markell, switching subjects, Vice President Biden, of course, lives in the state of Delaware, and recently he had some advice for his wife, Jill, about how to defend herself. Let's take a look.
I told my wife, we live in an area that's wooded and somewhat secluded. I said, Jill, if there's ever a problem, just walk out on the balcony here, or walk out, put that double-barrel shotgun and fire 2 blasts outside the house.
You have a smile on your face. What do you think of that?
Well, I think the point that he was making is that people are entitled to have weapons, use them for self-defense, and he's obviously right about that.
In fact, though, wouldn't what he just suggested be illegal? You know, it went on the blogs that in Delaware you have to have a fear of your life before you can use deadly force.
Well, I think what he's really saying is that if she felt like she was in danger, then she has a weapon and she can use it.
But in fact, it would be illegal.
Actually, I don't know. I mean, I think maybe he doesn't live in the city of Wilmington. He does live in a fairly secluded area. So I was not the least bit troubled by his comments.
Okay. That's a very politic answer. Governor, since he's the most famous constituent of your state. Governor Walker, let's turn to a specific issue with you. The last time we talked, you were battling and beating the public workers unions on their collective bargaining rights. The issue is still in the courts, still being appealed. But what has the effect of your reforms been, both on the budget for the state and for localities and for the unions?
Well, it's been positive for the taxpayers. The taxpayers won, not only in our recall election, they won every time we've been upheld in the courts, in both the state courts and in the federal courts. And the real impact, we just announced last Wednesday in our state budget, was we went 2 years ago from a $3.6 billion budget deficit to nearly a $500 million surplus. We took that money and invested in tax cuts. We increased funding based on performance for our schools. We invested in things like Jack talked about with workforce development. Those are things we're able to do.
Did that specifically come from the fact that the public workers unions couldn't negotiate, couldn't collectively bargain?
Well, in terms of collective bargaining, we knew 2 years ago, unlike what they're doing here in Washington, we had to tackle the biggest part of our budget. In Washington, they're not tackling entitlements. We knew the biggest driver in our budget, every state's different, was aid to local governments, and we knew if we were going to reduce that, the only way we could do that without crippling local services was empowering, much as I had been a local official for 8 years, was empowering local governments to be able to make changes, not just in terms of pension and health care contributions, but even things like stopping overtime abuse, work rule changes that schedule things that make things more financially available for our schools and our local governments. We did that, and in turn, we were able to balance our budget. Our economy got better.
Let's turn to another subject, because one of the big jobs that all the governors are going to face over the next year is beginning to implement Obamacare, which kicks in officially the following year, the beginning of 2014. Governor Markell, you've agreed to the expansion of Medicaid in your state, and you're going to work with the feds in setting up the health exchange in the state. It's going to be kind of a partnership between Delaware and the federal government. With all the spending problems here in Washington, are you worried that maybe not the first year or the second year, but at some point you're going to end up footing the bill for Obamacare?
Well, first of all, I think they've made it very clear that they intend to stick with the deal that was offered to the states in terms of Medicaid expansion. We made that decision for reasons of math. We get to cover additional people who otherwise would not have had coverage, would have ended up in the most expensive place of all, which is the emergency room. The federal government's going to pick up 100% of the cost for 3 years, 90% thereafter. In addition, for us, there's actually a higher reimbursement for people that we're already serving. So for Delaware taxpayers, that made sense. The really exciting move about health care, though, is not what's happening in Washington. It's what's happening in states around the country. Some of the incredible innovations to move away from the fee-for-service model. Some great work being done in Oregon, in Arkansas, and many other states. A number of states, including Delaware, just last week received innovation grants from the Department of Health and Human Services to focus on exactly that.
Well, I want to stay with Obamacare, though, if you will, because Governor Walker, you made a very different decision. You have refused the expanded Medicaid, even though the feds were talking about picking up all the costs, as Governor Markell mentions, for the first 3 years and 90% thereafter. And you also said, we're not going to run the health exchange. We're going to let Washington do it. How come?
Well, for us, every state's a little different. Governor Markell and I talked about this not only between Democrats and Republicans, but even sometimes amongst members of the same party. In our case, it was a better deal for us not to take the funds, and instead we're able to do an alternative. We reduced the number of uninsured by 224,580. We actually reduced the number of people on Medicaid, put 87,000 people into the marketplace, and replaced them with 82,000 people who are currently living in poverty today but weren't eligible under a cap in the past from my predecessor.
They're getting a little in the weeds, but I want to ask you, because you pointed out the fact that there has been some difference within the parties. As you well know, 7 Republican governors have agreed to the expansion of Medicare to 133% of the poverty rate. Here they are up on the screen, including well-known conservatives like Rick Scott of Florida this week, John Kasich of Ohio, and they say they're doing it because of, if you will, free money. The fact that they said our taxpayers are having to pay into this system, so they ought to get the benefits of it, and if the government's willing to pay 100% of the cost, we'd be crazy not to accept it. And critics say that your decision is, one, going to cost your state millions of dollars, and two, going to mean a lot of people in Wisconsin are uninsured.
Well, actually, but again, every state's different. That's why I won't criticize them, be it those Republicans or other Democrats, because every state is different. In our case, we actually reduced the number of uninsured, we reduced the number of people on Medicaid, and we actually saved a little bit of money. Now, we could
but is part of it also that you're afraid that the feds aren't going to live up to this?
No doubt about it. The federal government has a $16.5 trillion debt today. Just for my cost to continue Medicaid in the state of Wisconsin without any expansion, it cost me $644 million more in this budget. 39% of that is because the federal government, under the Affordable Care Act and other provisions, is pulling back from the previous commitments. That's today. That's without the expansion. So I already look at that and say, if Congress can't fulfill the commitments they've made, I'm concerned about where they're going to be in the future. But that's unique to Wisconsin.
Well, it isn't unique to Wisconsin.
But the number is unique. What I'm saying is every state's a little bit different.
I understand, but Governor Markell, why is it that he doesn't trust Washington and you do?
Well, I think actually, I mean, the bigger story, and the one that I think a lot of people miss, is the fact that no matter what happened with respect to the Affordable Care Act, what this country has to do is move away from what has become a sick care system where people get paid based on how many procedures they do to a health care system where people get paid based on quality. I mean, we really do have the opportunity to improve quality, reduce costs simultaneously. The Affordable Care Act provides that foundation. And now
that's what Obamacare was supposed to do, but it didn't do that.
But no, I think you're taking a look at a point in time. First of all, health care rates have not increased at the same rate that they had before. And secondly, if you're looking at some of the innovations around the country, we just heard yesterday in our governors only meeting from some of the governors who are already seeing really significant improvements in the reduction of cost.
All right, we're going to have to leave it there. Governor Walker, Governor Markell, thank you both so much for coming in.
Thank you.
Please come back.
Thanks.